Open up the doors. All right. Let's open up the doors and welcome to Daily with Doc and Becca. My name is Coach AJ, and I will be your host today. I'm just here assisting Becca, and we have the great Pharmacist Ben Fuchs on our show today. So you are in for a treat because Ben is going to talk about a very important topic, and he's going to take your questions. But remember, folks, if you were invited to this live show by someone and you find that something touches you or is important to you or relevant to you, get back with the person that invited you so that they can assist you on your health journey. And I just want to mention that the statements in this program have not been evaluated by the FDA, and the content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary physician. The testimonials shared in this show are they belong to the individuals sharing their testimony, and results vary and may not be typical. But as an empowered individual, you do have options available to you, and we are honored to have Pharmacist Ben Fuchs with us today. Pharmacist Ben Fuchs is a registered pharmacist, a nutritionist. He holds degrees from the University of Syracuse, close to my home, and he is a registered pharmacist who has gotten his degree at the University of Colorado. Pharmacist Ben has been lecturing around the country and some parts of the world for many years. We're honored to have him with us today. And one little secret that folks may not know about Pharmacist Ben is that he is a fellow New Yorker. So if you don't mind bringing to the screen our good friend Pharmacist Ben.
Hey, thank you, everybody. And actually, I'm a Coloradan officially now. I escaped.
Is there a year's limit on that? That, you know, once you...
Yeah, statute of limitations is up on my New York career, my New York existence. I got out of there as soon as I was of age. Anyway, thank you, AJ. That was wonderful. I couldn't have said it better myself. Actually, I think I did write that, didn't I, AJ?
Yeah, you kind of...
Yeah. All right. Anyway, happy Doctor's Day. You guys know about Doctor's Day, right? Did you know it was Doctor's Day?
Yeah,
Doctor Appreciation Day.
We've heard that, and we're appreciating our good Dr. Wallach. And
Dr. Wallach is our favorite doctor here. But you know what? Everybody who is serious about doing longevity is a doctor, not an honorary doctor, an etymological doctor. Etymology is the study of words. The word doctor comes from the Greek word docere, which is where we get the word doctrine. And the word doctor actually means to teach. A doctrine is a teaching, docere is teacher, docere refers to teaching. So the term doctor was officially designated on people who were teachers. And so anybody who's successful in longevity or attempting to be successful in longevity is a teacher. This is what all the successful people in longevity have in common. They're all teachers, whether we're teaching about health or nutrition or business or IT or all the different things that we learn about with longevity. We learn when we're involved with longevity. Longevity is really a learning company. The way I look at it, it's a personal development company. And part of personal development is physical health, but there's also mental health and there's also emotional health. And everybody who's involved with longevity, who's serious about their involvement with longevity, not everybody who's doing longevity, of course, is involved in the business, but if you're serious about the business, you're a teacher. And not only are we teachers, we're also students. We're students and we're teachers. And what I found, and I've been doing this for 27 years with longevity, what I found with longevity is that people in longevity who really participate aren't crowd followers. They're free thinkers. They're skeptical of the mainstream. Everybody I know who is involved with longevity is somehow outside of the mainstream and with something to do with their beliefs. They don't buy the party line, just like Doc. You know, Doc was outside the mainstream, and he gave birth to this company, and we all are kind of following his lead. We're not following the mainstream when it comes to the medical model. We're not following the mainstream when it comes to health and nutrition. We don't follow the mainstream when it comes to the news, which we're going to talk about here in a second, because of that niacin study that just came out. You know, we have a lot of crises in this country. We've got a drug crisis, we've got a health crisis, we've got environmental crisis, we've got political crisis, there's wars. I mean, it really kind of feels like the world's falling apart with all of the crises that we're enduring in the year 2024. But one of the biggest crises is the crisis that maybe underlies all the other crises, and something we don't really talk about, and that's a crisis in critical thinking. We don't critically think. We just take information sort of like a way I kind of picture a fish in the ocean with his mouth open getting food. You know, that's how fish feed themselves. They have their mouth open and the food just goes into their mouth. It's sort of a passive way of ingesting nourishment. And sometimes I think that's how we ingest intelligent nourishment or information, if you will. We kind of like fish, and we just take whatever is given to us. We got to learn how to critically think. You can't get your news from the news if you really want to know what's going on. You can't get news from the mainstream media, and you can't get health news from mainstream medicine. And interestingly, media and medicine both have the same root, med, M-E-D, which means middle. The representatives of the medical model and the representatives of the media are middlemen. They're representing for us. What longevity is all about, and I've told the story before with Dr. Wallach, when I asked Dr. Wallach once, when I asked him about American longevity, why he named the company American Longevity, he said, because it was his two favorite things. It was about America, and it was about longevity. It was about health, and it was about independence. It was about being your own person, being authentic, not having a job and working for somebody else, but working for yourself. And really, that's what not participating with the media or not participating with mainstream medicine is really all about. It's about being your own health authority, being your own authority in general, not trying to get information secondhand, not trying to get health information just because you were told something, but actually to experiment, to research, to participate, to look for alternatives. And interestingly, when we call what we call alternative medicine or complementary medicine, sometimes they call it complementary and alternative medicine, really to people like us who are skeptical of the mainstream, it's not alternative at all. The drug model is alternative. The pharmacological model should be alternative. The medical model should be alternative. What we're doing here with health and nutrition, with longevity, that's the primary way we should be staying healthy. And in fact, if we're not healthy, it's usually because we're not participating or not accurately employing or leveraging the power of nutrition. Now, when it comes to critical thinking, which means basically not buying the party line, not getting your information from the news, there was a study that came out, two very interesting studies that came out in the last week that sort of flew in the face of everything we really know about nutrition. But if you understand how the body works, you understand about health, you participate a little bit in working with nutritional supplementation, you know that there's no way these things could have been right. One of the studies came out that said that if you practice intermittent fasting, you are 91% more likely to die. And the second study that came out, if you read the headlines anyway, said that niacin, vitamin B3, may increase your risk of cardiovascular disease. So what the heck's going on? Intermittent fasting is good for us, right? How can intermittent fasting increase your chances of dying by 91%? Niacin is an essential nutrient. How could taking niacin increase your risks of cardiovascular disease? Well, obviously these things are wrong, but if you don't dig deeper past the headlines, which most people don't, present company excluded, you'll say, I'm not going to take any niacin. I'm not going to intermittently fast. I'm going to increase my risks of death by 91% if I intermittently fast. I'm going to increase my risk for getting a cardiovascular disease if I take niacin. Well, if you dig deeper, you'll see that the study on intermittent fasting merely checked on people who were eating in an 8-hour window and not eating for 16 hours a day. In other words, they according to the survey that was done, which was a questionnaire basically, they asked people when they ate and when they didn't eat, or what time of day they ate, and they put together all the numbers, and they found if people who ate within an 8-hour window and then did not eat within the remaining 16 hours of the day, they had a higher risk of dying, a significantly higher risk of dying. But they never checked on what the people were eating. They didn't see if the people were eating pizza, or they were eating Snickers bars, or they were eating processed foods and ham and bacon. They never bothered to check. They never bothered to check if the people smoked. They never bothered to check if the people took drugs, illegal or otherwise. They never checked to see if the people exercised. So while the headlines were very catchy, intermittent fasting increases your risk of death at 91%, if you critically think and you analyze data and you read deeper past the headlines, you see that that's a ridiculous conclusion, because the criteria that was used did not account for most of the criteria that are involved with death and disease, or early death and disease, which is the kind of foods we're eating, the kind of lifestyle we're living. None of that was controlled for. As far as the niacin study goes, if you read the headlines, you'll be freaked out. You say, oh my gosh, if you take niacin, you're going to increase your risk of cardiovascular disease. Well, aside from the fact that niacin is one of the most important cardiovascular health supplements that you could take, aside from the fact that it's an essential nutrient that you have to have in the diet, or you suffer from a deficiency disease, a particularly nasty deficiency disease called pellagra, we'll talk about here in a minute. If you factor all that in, you say there's no way niacin could cause increased risk in cardiovascular disease. Well, guess what? Despite the headlines that said taking niacin could increase your risk for cardiovascular disease, despite the headline, the test and the research never checked for niacin. They checked for a breakdown product of niacin, two breakdown products called 2-PY and 4-PY. Now, 2-PY and 4-PY are breakdown products of niacin, and they found that elevated levels of 2-PY and 4-PY, these metabolites they call them, or breakdown products of niacin, were elevated in people who had cardiovascular disease. They didn't check for niacin. They checked for 2-PY and 4-PY, which are breakdown products of niacin. But here's where it gets really insidious, sneaky, and misleading. 2-PY and 4-PY, which are breakdown products of niacin, are elevated when you have kidney disease. And almost everybody who has cardiovascular disease has some degree of kidney dysfunction. So 2-PY and 4-PY elevations are associated with cardiovascular disease, not because they're breakdown products of niacin, but because they are associated with kidney disease. But that didn't make the headlines. And if you don't read past the headlines, you're going to say, oh my gosh, I'm not going to take any niacin because it increases my risk of cardiovascular disease, when that wasn't even checked for. Which is all to say that you cannot go by the mainstream. You cannot get your news from the mainstream, whether it's political news or whether it's more personal news about health. As far as niacin goes, vitamin B3, it's one of the most important of all the essential nutrients. In fact, niacin is so important as an essential nutrient that under deficiency conditions, the body will actually make a little bit of niacin. There's no other vitamin that the body will actually make. Vitamin D is made by a reaction of the sun, a reaction from the sun, but it needs the sun. So you might say vitamin D is kind of made by the body, but it's not really. It has to be activated by the sun. Niacin is actually made by the body. There's biochemistry in the body that will turn an amino acid into niacin under deficiency conditions. That's how important niacin is. Niacin is critical for energy production. The way the body turns food into energy involves niacin, or a derivative of niacin, as a middleman. That means all of the energy production chemistry in the body and everything that depends on energy, which of course is everything, is dependent on vitamin B3 niacin. The heart is an especially hard-working organ. And the harder working organs are going to be using the most energy. Those are going to be the ones that are most dependent on niacin. The brain, too, is a hard-working organ. That's also dependent on niacin. And then the skin, which is turning over very quickly, and the intestine, the lining of the intestine, which turns over very quickly, is also dependent on energy. And both of those systems are dependent on niacin. In fact, if you go to medical school, you'll learn that the deficiency disease that's associated with niacin, a lack of niacin, or niacin deficiency disease, is called pellagra. And pellagra is a horrific disease that used to kill a lot of people before it was discovered that a little bit of niacin would prevent pellagra. If you go to medical school, they'll tell you pellagra is marked by the 4 Ds. They call it the 4 Ds of pellagra. The 4 Ds of pellagra are diarrhea, dermatitis, dementia, and death. They call it the 4 Ds of pellagra. Deficiencies in vitamin B3 will cause diarrhea, meaning intestinal problems. How many people have intestinal problems? They don't know what's causing it. It could be a simple niacin deficiency. Dementia might not have to be full-blown dementia, but it could be just forgetfulness, or it could be cognitive difficulties, learning disabilities. Dermatitis might not be a full-blown dermatitis. It might just be itchy skin. It might just be rashy skin. In fact, down south in the southern states after the Civil War, niacin was hard to come by. Niacin is found in high-protein foods. The poorer countries and poor areas of this country tended to subsist on non-protein foods, more starchy foods. In the case of the post-Civil War South, they were eating a lot of corn, and they weren't getting enough protein, not getting enough protein-rich foods, so they had niacin deficiencies. And when they went out to work in the sun, pick cotton, they would end up with dermatitises around the neck area. They're out in the sun, and their neck was exposed to the sun. They'd have red necks. And this is where we actually get the term redneck from. No kidding. This is not a lie. This is a true story. The term rednecks comes from the pellagra that people who were working in the cotton fields after the Civil War were subjected to, would have to endure. George Washington Carver came up with peanut butter as a way of making sure that people could have a cheap source of protein and a cheap source of niacin for people who are dealing with pellagra. The word pellagra, by the way, means rough skin in Italian. So niacin deficiency is associated with problems with the digestive tract, problems with the skin, neurological problems. Niacin, by the way, has been used to treat things like social anxiety disorder, psychoses. Dr. Abram Hoffer, who wrote a book called Orthomolecular Psychiatry back in the 1950s or early 1960s maybe, where he talked about using nutrients for psychiatric issues, used to treat his schizophrenic patients with niacin. So niacin is involved in a whole bunch of different health issues. One of the most important reasons, one of the most important places for niacin in the body is in something called the glucose tolerance factor. The glucose tolerance factor is a complex of molecules that helps the body handle, as the name implies, glucose. It supports insulin. Well, the glucose tolerance factor is composed of, largely anyway, chromium, which is part of our sweeties, and niacin. I always recommend the ultimate niacin for people who are dealing with blood sugar issues to go with the healthy blood sugar pack, because niacin is important for the glucose tolerance factor, which in turn helps the body process sugar. Niacin is also one of the best, maybe the best, cholesterol-lowering supplement there is. Using niacin to lower cholesterol has the same potency as using a statin drug to lower cholesterol. Interestingly, and we said this before, elevated cholesterol is associated with high blood sugar, so it makes perfect sense that a supplement that would help the body handle sugar would also help the body lower cholesterol. Topically, niacin can be used to strengthen the skin barrier, and niacin applied topically actually has anti-hyperpigmentation, skin lightening benefits when you apply niacin topically. I use niacin in a lot of my topical formulations. It's one of those one of the few vitamins, along with vitamin C and vitamin A, that can actually be leveraged by the skin upon topical application. The one knock on niacin is, of course, as most people know, the famous niacin flush. The niacin flush is when you take niacin and you get hot and itchy. That's caused by the vasodilation, the blood vessel opening effect that niacin has. Now, the niacin flush only occurs when you first start taking niacin. Over time, you don't get the niacin flush. Using the ultimate EFAs with your ultimate niacin can help reduce the impact of the niacin flush. You'll get less niacin flush if you're supplementing with the ultimate EFAs. If your client really doesn't like the niacin flush, doesn't want to deal with it, there are no flush forms of niacin, but they're not going to have the same potency as plain old niacin. Niacinamide is a no flush form of niacin. There's a form of niacin called hang on a second. The only thing about niacin hexanicotinoate. I believe it's called hexanicotinoate, and that's a form of niacin that's also no flush niacin. And then there's another form of niacin called niacin riboside. But plain old niacin, like we have the ultimate niacin, is going to be the most effective for the most people. Plain old niacin. The hexanicotinoate, inositol is what it's called. Inositol hexanicotinoate is a no flush niacin, and also niacin riboside is a no flush niacin. But these are very expensive forms of niacin, and they're not going to give you much more niacin benefit. They're not going to give you any more niacin benefits than plain old niacin. I always suggest the ultimate niacin. Build yourself up slowly. Take one capsule make sure you're using your ultimate EFAs, and if you take with food, your chances of getting the flush are significantly reduced. So niacin is arguably the most important of the vitamins, at least in the sense that the body will make it. It's used for brain health. It's important for mood. It's important for anxiety issues. Niacin helps stabilize blood sugar. It's got cardiovascular health benefits via its stabilization of blood sugar. Also, it's cholesterol. It's a cholesterol lowering effects. And then niacin also plays a very important role in skin health, both internally and topically. And niacin is important for the health of the digestive system, as well as the brain. Sometimes I wonder how many people who are in nursing homes or even at just being taken care of at home who have dementia issues, so-called Alzheimer's dementias or Parkinson's dementias or any other kind of dementias, are simply suffering from niacin deficiency. The more sugar you're eating or processed food you're eating, the more niacin you need. So don't pay any attention to headlines. Make sure you're digging deeper past the headlines. If you can't read the entire study, read a summary of the study before you form conclusions. Don't form conclusions just from the headlines or what you hear on the news. In the case of the study on niacin, they didn't test for niacin. They tested for breakdown products of niacin, which are elevated when people have kidney disease. And then in the case of the intermittent fasting study, they never bothered to check what the people who were intermittently fasting were eating, or what their lifestyle was like, or what kind of drugs they were taking, etc. As far as intermittent fasting goes, I don't consider intermittent fasting to be just not eating for 16 hours a day. I consider intermittent fasting to be not eating for a whole day once or twice a month. To me, that's an intermittent fast. Just not eating for a certain part of the day, that's not really a fast. Although calorie restriction of all kinds is always going to be beneficial. So you will get benefits from intermittent fasting if you consider your intermittent fasting to be just like fasting 16 hours or 12 hours every day. But the best way to intermittently fast is to take a whole day off from food for one day a month or 2 days a month. It's still not a bad idea to intermittently fast by restricting your calories during the day, but it's not going to be as effective as taking a whole day off from food, like a 24-hour fast or a 48-hour fast. All right, does that all make sense?
Ben.
Yes.
It all makes a lot of sense. It's just amazing the amount of information that you can pack into such a short amount of time. It's really good to hear. And one of the besides all the really good health information that you gave, it's very interesting that you snuck in there that George Washington Carver helped the rednecks. That's like something that's going to be
like that?
that's gonna go worldwide there. So, well, that's fantastic, Ben. And what do you think is the reason that some of the headlines might be a
Because
little
it's sexy. It gets your attention. It got my attention. I was like, what? Niacin, cardiovascular disease, intermittent fasting, increase your risk of death. It totally got my attention. And it got a lot of people's attention. You know, if you do a Google search on niacin cardiovascular disease, you'll see page after page after page with that headline. Taking niacin may increase your risks of cardiovascular disease. That study said nothing even remotely like that. Again, it talked about two breakdown products of niacin, but it's attention getting. The media is not there to inform us. The media is there to sell advertising. That's what clicks are. Every time you click on something, somebody's making some money somewhere. You know, Google's making money, or Facebook's making money, or the media source that you clicked on is making money. The object is not to inform us. The object is to make money. And that's how they do it. And I like to make money too, but that doesn't mean that you have to participate in their money making, in their money grab.
or
So
mislead someone in order to do
that's
it.
how it is. That's how the news is. The news is naturally going to be misleading, just because they can't give you all the information. They have to give you the information that they think is going to be the most compelling. And so when the study comes out that talks about metabolites of niacin, that's not going to be as interesting to you as niacin. If they said 2-PY and 4-PY are associated with cardiovascular disease, that wouldn't get anybody's attention. But because 2-PY and 4-PY are breakdown products of niacin, they felt comfortable saying niacin. And by the way, they're not blatantly dishonest. They're only subtly dishonest. So if you read the headlines, they'll say may be associated with cardiovascular disease, suggests an association with cardiovascular disease, implies or links. It never says it directly, but most people don't read past that. They'll just see the two words, niacin and cardiovascular disease. And I can't tell you how many calls and emails I got saying, why are you recommending niacin when it's associated with cardiovascular disease? Because we don't read past the headlines. But get online, go online and see. You'll see it. They don't say blatantly that niacin is the cause of cardiovascular disease. They say it suggests, or words to that effect. So they're protecting themselves, but because when we read, we don't really read we don't read with vigilance, which you always have to read with vigilance. And again, present company excluded. Those of us on this call are playing a bigger role in their own health and in our own health and in our own information gathering processes than most people. Most people, as I say, get their information passively. You want to get your information actively by participating in it.
Fantastic, Ben.
Okay.
Fantastic, as usual. Well, would you like to take some questions at this point?
I'd love to take some questions.
I think that we're probably going to have a lot of questions today. First up, we have Mark. Mark, you're on your iPhone. Can you unmute yourself?
Yes. Can you hear me?
Would you like to join us on the screen?
Oh, hey, Mark.
Okay.
How are you, Ben?
What are you using for shampoo these days, Mark?
Yeah, I'm thinking the same. I have the same question, but I have a similar question actually. I'm having, since I'm 21, I'm 128 pounds, and since for 4 years, I've been having at the start was not so heavy, but today is very heavy hair loss. I have a lot of hair loss.
Okay, yeah.
I don't know why. I'm 21 years old. All my friends, they don't have hair loss. I don't know what's going on.
Yeah, there's a couple things. Early hair loss is often associated with surges in a very powerful hormone that is a derivative of testosterone. And testosterone, as I'm sure you know, is a male hormone, androgenic hormone. It's a building hormone. Testosterone is broken down into another chemical, a derivative of testosterone called DHT, or dihydrotestosterone. And dihydrotestosterone is the bad guy when it comes to all of the testosterone, all of the body symptoms that are associated with elevated testosterone, including hair loss, acne, and male prostate disease. All of them are associated with dihydrotestosterone. So early hair loss, by the way, is maybe an indicator that you may be at risk for prostate problems. As you get older, it won't happen until you get older if you're only 21, but that might be something to consider. So things that inhibit DHT can be very helpful for you. One of the most important DHT inhibitors is the zinc FX. In fact, zinc FX, that's one of zinc's most important roles. It's a DHT inhibitor. So you might want to consider using zinc supplements. Niacin, the aforementioned niacin, is actually a topical hair treatment for increasing hair growth, probably because it has a vasodilating effect. It increases blood flow to the head, to the hair a lot. When you have hair loss, you're dealing really with a follicle issue. Hairs grow out of follicles, and people your hair's dead. There's nothing you could do for your hair. Once your hair is out of your head, it's gone. It's dead. It's out of the body. So there's nothing you could do directly to the hair, but you can approach the follicle either with topical niacin or by using the ultimate niacin as a supplement. And by the way, whenever you take one B vitamin, it's a good idea to take all of them because they exist in nature as a complex. If you're going to take the ultimate niacin, make sure you take it with your Beyond Tangy Tangerine. One of the really neat things about the Beyond, there's a lot of neat things about the Beyond Tangy Tangerine, but one of the neatest things, one of my favorite aspects of the BTT is its high concentration of the B vitamins. The B vitamins are your energy vitamins. They help the body turn food into energy, all of the B vitamins. And so it's a good idea to take all your B vitamins when you take your ultimate niacin. And then there's also some literature that talks about vitamin D being helpful for increasing hair, for folks who are dealing with hair loss, for improving hair growth. And you get vitamin D, of course, from the sun, or you can also get supplemental vitamin D. I like vitamin D from the sun. And then there's also the hormonal connection, aside from testosterone. Using your ultimate EFAs can support estrogen, and estrogen is associated with having nice, beautiful hair. So making sure you're using your ultimate EFAs. And then lastly, one of the reasons why people have problems with testosterone is something called insulin resistance. There's an overlap between sugar metabolism and the secretion of male hormones. So I don't know necessarily that you're dealing with insulin resistance. You seem kind of young to be dealing with insulin resistance. Nonetheless, treating yourself like a diabetic by using the healthy blood sugar pack as well as the ultimate niacin may also help you if you're dealing with male pattern baldness, anybody who's dealing with male pattern baldness or hair loss. Did you, Mark? You're muted, Mark.
I guess Mark muted himself.
Yeah.
Okay.
I have a question because I'm so underweight and I'm not eating like few food. I'm eating good food and I'm super underweight. My next question was, could the hair loss be linked with the thyroid? With the thyroid?
100%. It almost always is linked with the thyroid. The thyroid, every single chronic health challenge you can name is linked to the thyroid because the thyroid controls everything. And I know I've said this before, but I'll just, repetitions, reinforcements, I'll just say it again. Bone cells, bone, under control of thyroid hormone. Skin cells, skin, under control of thyroid hormone. Muscle cells, muscle. Heart cells, heart. Intestinal cells, intestine. Brain cells, brain. In other words, cells do what they do. Whatever it is a cell is supposed to do, it does under the control of thyroid hormone. Which means if you're hypothyroid, everything is operating less effectively. Every single system. So no matter what your health challenge is, you can pretty much rest assured underneath there's some aspect of poor thyroid functioning, hypothyroidism. The problem with the thyroid is you can't really do anything about the thyroid by itself because the thyroid is responsive to the adrenal glands, to the blood sugar system, and to the digestive system. This is where the triangle of disease comes in. The thyroid is the tip of the triangle of disease, and from there, all diseases ensue. It's the jumping off point to chronic degenerative disease. But you can't deal with your chronic degenerative disease until you deal with your thyroid, and you can't deal with your thyroid until you deal with stress, adrenal stress, which doesn't have to be psychological, it could be physiologic stress, blood sugar issues, and digestive issues. That's the triangle of disease, and everybody should be focusing on that triangle. The good news about the triangle of disease is if you work at that level of at those 3 points, all your other health challenges will take care of themselves. The bad news is if you don't work at the triangle of disease, you can't deal with your hair loss or your heart problems or your neurological issues or autoimmunity or whatever it is because they're secondary or they follow breakdowns at the level of the triangle.
Yes. Yes, I got it. But and do you think that for the thyroid could be especially helpful or beneficial to take like Lugol's or Ocean's Gold
Yeah,
or something like that?
oh, yeah, Lugol's or Ocean's Gold or Fucoid Z. Yeah, those are all good sources of iodine. It's unlikely that you have a full-blown iodine deficiency. You'd have a goiter if you did, but taking a little iodine is not a bad idea. Taking extra iodine is not a bad idea, whether it's in the Ocean's Gold or the Fucoid Z, wherever you take it. Iodine is important not just for the thyroid, though. Iodine is very important for the thyroid because you can't make thyroid hormone without it. But iodine is also very important for all of the glands of the body, including the adrenal glands and the pancreas and the breasts and the ovaries for women. So all in the prostate for men. Iodine is an important hormone for all of the glands of the body. Iodine is pretty much only found in seafood. Iodine is not a terrestrial mineral. So you got to make sure that you're eating seafood. And if you're not eating seafood or you're living inland and not getting enough seafood, your odds of suffering from an iodine deficiency go up. Iodine deficiency, full-blown iodine deficiencies don't happen anymore because of iodized salt, but we still could be dealing with subclinical iodine deficiencies. And the nature of subclinical deficiencies is something we talked about before. It's really important because you may not have a full-blown iodine deficiency where you have a goiter, but you may have a little bit less iodine than you need, which means your thyroid and your other glands aren't going to be functioning as effectively. So it's always a good idea to either eat iodine-containing foods, which, as I say, are seafoods and seaweed, or get your Fucoid Z and your Ocean's Gold.
Got it. And I have my last question I want to ask. You usually talk about like 50. I watch a lot of your Moment of Truth, and you say a lot of times about 1,500 calories or 1,200 calories. That's like the sweet spot for clean energy. I want to ask you, if I consume like 1,200 calories, I will be like malnourished in like 4 days because
No,
I will be
won't.
like.
You would not be malnourished. No, malnourishment doesn't come from calories. Energy comes from calories. Nourishment comes from nutrients, protein, fats, and carbohydrates, but also micronutrients. So
okay, but I will be super like underweight.
No, well, hang on. You've got to you don't want to be fat. You don't want to get fat. You want lean muscle mass. You want to build muscle. You don't want to just be fat, right? So when you say I want to gain weight, you don't mean you want to gain weight. You want to gain muscle. So how do you gain muscle? By making your body work in combination with anabolic or building nutrients. That means all your micronutrients, and then Fit Shake or TMR for protein, and your ultimate EFAs, and the gym. Or if you don't want to go to the gym, push-ups, pull-ups, resistance training, not walking, not taking a walk around the park, resistance training. That's the only way to build muscle in combination with nutrition. It's not calories that you're looking for. Calories are only energy. So when I say 1,200 calories, I'm talking about 1,200 calories with micronutrients that help your body take advantage of those calories. Other than that, calories represent work. The body doesn't, you don't want the body to have to work to process food, because the more work the more resources it's spending, the more of its resources it's spending to digest your food, the less resources it's going to have to build muscle or to fight diseases or to grow and repair or to do all the good stuff. So really what calorie restriction does is it allows the body to divert its resources, its nutritional resources, away from digestion towards anabolism, which means building. Now that doesn't mean you still need calories. You still need some calories, but 1,200 to 1,500 is plenty for most people. Now, if you're working out, if you're an athlete, if you're recovering from surgery, if you're pregnant, there are times when you need more calories. But for most of us, we're getting 3,000 to 4,000 calories a day, and we're not pregnant or working out, and we're not athletes. We're just eating. And that represents work to the body, and that represents a diversion of nutritional resources away from your muscles, and away from your immune system, and away from your skin, and away from your heart and your brain towards the digestive tract. Do you ever wonder why you eat food, or not you, I'm not talking about you, but we eat food, right? We eat a nice meal, we put all this energy into our body, and then we need a nap. Do you ever wonder about that? There are whole countries that shut down after lunch. We just put fuel, we just put food in our body. Why are we tired all of a sudden? because it's work for the body to have to digest, to process food. All the nutritional and biochemical resources get diverted from your brain to your intestine, to your stomach, to your digestive system, so that you can digest your food. Also, by the way, and this has to do more with intermittent fasting or calorie restriction, where you take time off from food. And we talked about this before, but I'll say it again. There is a part of the intestine that's electrical, that propels food through the intestine and out the body. That electrical system is called the migrating motor complex, the MMC. And this migrating motor complex, which is basically an electrical system that causes the muscles of the digestive tract to contract and kind of pushes the food out of the body, it's turned off by food. So when we eat food, the migrating motor complex is inactivated so that you can absorb the nutrients, because you don't want to eat food and have everything come out your body. So the migrating motor complex is suppressed by food. When you stop eating, the migrating motor complex kicks back in so that the food can be cleared out of the body. Whatever the residual food in the digestive tract can be cleared out. We all know the migrating motor complex by its sound. You can hear the migrating motor complex. We call it a rumbling in our tummy. That rumbling in your tummy, which most people will say means you have to eat, really is your body cleaning itself out. And so what we want to learn to do is we want to minimize the amount of minimize the amount of food we put in our system, so our body has more time to clean itself out. So, and by the way, in addition to the food being cleaned out of our bodies more effectively when we stop eating, the body also cleans out dead and dysfunctional cells via a process called autophagy when we stop eating. So less food means better detoxification, both of cells and of food out of the intestine. This can be especially important for people who are chronically constipated, which is a lot of people, and women who are dealing with excess estrogen symptoms, which include inflammation, autoimmunity, hypothyroidism, depression, weight gain, anxiety, a whole slew of symptoms that are associated with excess estrogen, because women especially don't eliminate estrogen out of the bowels effectively. And as estrogen builds up, that too can cause constipation, leading to more estrogen buildup, leading to more constipation. So these strategies for clearing out food out of the intestine involving intermittent fasting are especially important for women who are dealing with estrogenic symptoms, which are a lot. And we should probably do a whole Daily with Doc on estrogen, because it's such an important hormone, especially for folks dealing with inflammatory health challenges.
That's Ben, you remind me of Crazy Eddie.
Really? He's insane.
No, because you're giving it all away.
Oh, okay. I shouldn't give it.
Yeah. So next, I want to go to our fearless leader, Becca Dukes, who graciously allowed me to host the show today, and I'm really thrilled. But we need to hear from Becca, and I know that Becca has got a question, so.
I have a few questions, but first I want to thank AJ for stepping up. I wasn't sure if I was going to be back from my emergency family leave or not in time, and I am. So here we are. Pharmacist Ben, you're a rock star, and just the information that you share is priceless. So thank you so much for all that you do. With it being National Doctors Day, I do want to do a shout out to our Dr. Joel Wallach and our other doctors that we have. I know I saw Carrie is on with us as well. So thank you, Carrie. But Ben, we have questions coming from around the world, and some of the things that are being asked, because they're not trusting the system, is just incredible. I have one person that's asking a question: wanting to know about kidney disease. So an elderly woman, she's 92 years old, still going strong, but she's having some kidney issues, and they are worried about potassium. So I'm wondering what potassium does as far as kidney goes. And also, they're wanting to greatly reduce her protein intake to less than 20, I think it's less than 20 grams per day.
Well,
What?
that's unfortunate because if she's
Why?
92, she really needs protein. Elevated potassium, potassium has to be in balance with sodium. Too much potassium can cause cardiovascular problems. If she's 92 years old, she's obviously got to be careful of that. But at the same time, you need potassium. So, it's gonna, basically you want to look for the symptoms of high potassium, which include things like irregular heartbeat, muscle weakness, digestive or stomach pain, diarrhea, nausea, that kind of thing. Numbness sometimes is associated with potassium deficiency. So what I would be doing, excess potassium. What I would be doing is I'd be looking for symptoms of excess potassium and then dosing accordingly. If there are symptoms of excess potassium, then she wants to back down or balance it out with sodium. It's a little bit tricky because the kidney is supposed to do that work. That's what the kidney does. Kidney is supposed to excrete potassium when there's too much potassium or there's too little sodium, or vice versa. It'll increase sodium when there's too much sodium or too little potassium. So it's supposed to keep everything in balance. With kidney disease, that doesn't happen. The most important reason for kidney disease is dysglycemia, messed up blood sugar, whether or not somebody has been diagnosed as a diabetic. Now, if she's 92 and she doesn't know a lot about health, the chances are pretty good she is dealing with dysglycemia. If she's living the standard American lifestyle, it's almost impossible not to have messed up blood sugar unless you really know what you're doing. So that's where I would be working. The protein, the kidneys also process protein, and if she has kidney disease, she's not going to be able to process protein, and she could end up with elevated with too much protein in too much protein in the blood. And so that's what they're thinking about, reducing the work that the kidneys do, because the kidneys process protein. So by lowering protein, they reduce the load on the kidney. But being 92 years old, she needs protein. Protein is the primary building nutrient. So, I would, in my opinion, and she has to do whatever she wants to do, I would be working with the blood sugar more than trying to reduce protein. I don't know where she's at with her kidneys, so I can't really tell her just by talking, on the Zoom call, give her advice on the Zoom call. But they're thinking of not having the kidney do a lot of work. That's why they're reducing protein. Unfortunately, she needs protein to thrive, especially if she's older. Now, this gets to what we talked about before about doctors. Doctors are not here to help us thrive. This is so important. This is not a bad thing. It's not that they're dumb or they're bad people or they're evil or whatever it is. They're here to help us survive. That's all they care about. They do not care about us thriving. That's our job. And it's a good thing. We have a profession, healthcare professionals who want to help us survive. That's important. And so to them, they're going to do whatever it takes to keep her alive, even if it means cutting out her protein and cutting out her minerals, because they don't want to put work on, they don't want the kidneys to do more work than they're doing because she's got kidney damage. But in the interests of her survival, she will be affecting her ability to thrive. And that's where it becomes problematic. I don't know if she's in an emergency state. I don't know where she's at, but I can tell you that potassium is very important for energy and protein is very important for building. And a 92-year-old needs both energy and anabolism or building. So, without knowing where she's at, it may be that she needs to be on a low potassium diet. It may be that she needs to be on a low protein diet. I don't know. But it seems to me that using potassium and using protein can be important also for energy and for building. And she's going to be depriving herself of that.
Yeah. All right. Thank you so much for that information. We've got some really smart listeners out there out on YouTube. Storks or Sue, she mentioned how chicken has less potassium than beef. So that could be something, as if they're worried about the potassium levels being too high, but still getting a way to get protein. Is that correct?
I didn't know that chicken had less potassium than beef. They both have a good amount of potassium. I know that. I didn't realize the chicken had less than beef. But her main sources of potassium are going to be supplemental. That's where you really get the kick butt levels of potassium, not necessarily just from foods. I don't think they're probably not suggesting that she go on a low potassium diet in terms of foods. They're probably suggesting that she goes on a low potassium diet in terms of supplements, or she reduces her intake of potassium supplements. That's where the high doses of potassium come in from.
All right. And then we have Claudia who's on with us. She has a question, and I don't know, I think this might be a specific product or such. She wants to know what you think about giving Zeolite and activated charcoal to
I don't know what Zeolite. Charcoal is great for autistic kids. Charcoal is one of the all-time great detoxifiers. In pharmacy, we call it the universal antidote. And everybody should keep activated charcoal in their medicine cabinet, especially if you have kids around for accidental poisonings. Charcoal is amazing stuff. In fact, even just using charcoal as a supplement can be a great detox supplement. You don't want to take it too close to your other supplements or your medicine if you're on medicine, because it has an ability to magnetically attract things, and it will pull supplements, vitamins, minerals, etc., as well as medication if you're on medication out of your body. So you want to take it by itself, but taking charcoal on a regular basis, like every day on an empty stomach, is a great detox strategy. For folks dealing with injection toxicity, charcoal may help with that. It may help clean out the toxins associated with various injections, as well as alcohol. If people are drinking alcohol, it's a great hangover remedy using activated charcoal, or any other kind of toxicity if you have food poisoning. So activated charcoal is great. I'm not sure what the other thing you said was.
Yeah, zeolite.
Zeolite. Gotcha. Yeah, zeolite's very similar. It has a similar effects to charcoal. Both charcoal and zeolite have a large surface area that allows small particles to stick to them, magnetically stick to them. And zeolite is another great detox substance, I'll say. I don't think it's called a supplement, but it's a detox substance like charcoal. Autism is thought to be associated with gut or digestive toxicity. So it may be that zeolite and activated charcoal could be helpful. You also probably, for autistic kids or parents of autistic kids, you may also want to do a food diary, look at gluten and other hard to process foodstuffs. And then also the whole SIBO connection, small intestinal bacterial overgrowth, which we talked about in the past. There's a really cool book called The Gut and Psychology Syndrome, the Gut and Psychology Syndrome Diet, the GAPS diet, by a lady named Dr. Natasha Kinsky Campbell. And she not only outlines a very compelling case for the gut connection to emotional and psychological issues, including autism, but also strategies for dealing with it.
So from the longevity line of products, you're talking about detoxifying. What would you recommend?
For detoxification, one of the all-time great detoxification supplements that nobody talks enough about is plant-derived minerals. Plant-derived minerals not only are nutritive, but they're very detoxifying, especially for metals, for heavy metals. So I would recommend the Beyond Tangy Tangerine or anything with the plant-derived minerals for a longevity detox.
All right. And I know we have other questions.
There are also the liver cleanse. Dr. Aria's liver cleanse is also probably helpful.
The liver cleanse.
Yeah.
Yeah. So you were talking about detoxifying from injection or whatever. Well, I may on my time away gotten stung by a scorpion or something.
Yeah.
What would be a good way? Because my arm hurts, my fingers were all fat, and I still had feelings, but they were like numb.
Yeah, there's quite a few things. One of the body's most important detoxifying molecules is something called glutathione. You may have heard of that. Glutathione is made up of 3 major building blocks, which you will find in the Fit Shake in whey protein. I think that maybe not the TMR, but the Fit Shake. Also, Stay Natural has a whey protein, which has the building blocks for glutathione. MSM sulfur, the ultimate MSM, and also the selenium, the ultimate selenium is important for detoxification. And then the plant-derived minerals. And also vitamin C, the CFX.
Okay, so I'm on the right track. Thank you
Yes,
so
ma'am.
much. And
Yes.
I'm fasting, taking those things.
And then
So
fasting is another great detox strategy by virtue of its ability to improve bowel elimination.
all right. AJ, take it away.
Well, thank you, Boss Becca. It's always good to see you. And Pharmacist Ben, we're gonna go to our friend Debbie.
Hi,
And
Debbie.
Debbie changes lives, and we're gonna see what Debbie kind of question Debbie's got for us. Debbie, take it away.
Where's Debbie?
I am here. Can you see me?
Is that Debbie Voris?
Yes, Debbie Forrest.
Hi, Debbie. Did
Hey.
I answer your email?
Yes, you did. And I got to
Okay.
send you the information. I just haven't done that yet. I've been busy.
Great.
But anyways, I met somebody this week who did a keto diet and lost her hair. But after hearing what you told this other gentleman, there's probably some correlation, you know what I mean, to thyroid issues possibly.
Well, yeah, hair loss always involves thyroid issues.
Yeah.
Any kind of suppression or inhibition or slowing down in the body has to happen secondary to hypothyroidism. You can't have a slowdown in the body, whether it involves excessive breakdown, deterioration of tissue, accelerated aging, or hair loss. They have to follow. They have to be linked to the thyroid because the thyroid turns everything on. So if you're dealing with any kind of inhibited or suppressed or a breakdown in the body, hypothyroidism is behind it. But that doesn't mean that you work on the thyroid because you can't work on the thyroid directly.
Yeah, but a keto diet, would that really?
No,
Yeah.
keto diet is going to cause hair loss. No.
That's what I was trying to tell her, but she's just like, "Oh, it happened when I went on a keto diet." I said, "Well,
Okay,
it wasn't
all right.
very clean."
Hair loss doesn't happen right away. It takes a while for hair loss to happen. So if she went on the ketogenic diet and lost her hair the next day or a couple days after that, obviously there's something else going on because it takes time for the impact of what she's doing to affect her hair. The hair that you see on your head, it's already outside of your body. So hair isn't going to fall out of your head within a couple days of changing your diet. It would take a long time for that to happen.
And it took a long time for her hair to grow back, but she says
Why
it
is
was
she on the
because of
ketogenic diet? What's her thinking? Why did she go on it?
Well, she didn't do it with me. She did it with somebody else. So
Why?
she
What was her intent?
lose weight.
Well, she has a weight problem, right?
Mhm.
I mean, this is what we were talking about earlier. I don't know if you heard us on the call earlier. We don't critically think, so she has a weight problem. What's the weight problem due to? Well, probably due to some kind of dysglycemia. She's throwing off her insulin. Dysglycemia or messed up blood sugar, if you will. Dysglycemia means messed up blood sugar. Fancy way of saying that is associated with hair loss. So if she has a weight problem, she probably has a problem with her blood sugar. If she has a weight problem, she very likely is hypothyroid as well. Between dysglycemia and hypothyroidism, that will cause hair loss. So I wouldn't blame it on the ketogenic diet. She should blame it on the other things that were causing her to go on the ketogenic diet.
Yeah, and plus she didn't have any. She probably not taking any nutrients either, any micronutrients.
Yeah.
So, that makes a big difference.
Correlation is not causation. Have you ever heard that phrase? Correlation is not causation. Correlation is when two things are correlated. They happen together. Causation is actually a causal relationship. Just because two things happen together doesn't mean one caused the other, right? If your alarm clock goes off at the same time that the moon or that the sun comes up, that doesn't mean that the sun coming up made your alarm clock go off.
Or vice versa.
Or a rooster,
Right. Yeah. The rooster didn't make your alarm clock go off, and the alarm clock didn't make the rooster crow. They're correlated, but they're not causal. And so correlation is not causation.
Okay.
Thank you, Debbie.
Thank you.
And don't forget every Thursday to see Debbie on Debbie Changes Lives. She's doing the good work, and we need to support her. And here's our good friend Phyllis Anderson. And Phyllis, what kind of question do you have for Pharmacist Ben?
Such a great question. And hello, Ben. Always a pleasure.
Nice to see you, Phyllis. How long have I known you, Phyllis?
At least 25 years, I think.
Isn't that crazy? And you look exactly the same.
Thank you. Thank you. I'm asking about a man in his 60s, and he has chronic GERD and acid reflux with periodic discomfort in the lower esophagus. He's been diagnosed with a hiatal hernia and Barrett's esophagus.
Terrible. That's
I
absolutely
know.
terrible. Barrett's esophagus is one of the worst things that can happen to a human being.
There's more. Can I just, let me
Yeah.
just throw a couple more things in.
Yeah.
He's taking a proton pump inhibitor twice a day. And then often after dinner and twice a night, he'll take Tums. He's taking like 9 Tums a night. And besides this issue of the GERD and possible surgery, he's afraid he's getting too much calcium from the Tums. So take it away. This is your wheelhouse.
Well, yeah, he very likely could be getting too much calcium from the Tums. A hiatal hernia is basically going to allow acid to go up into the esophagus. A hiatal hernia is when the stomach pops through the diaphragm, and it's often associated with GERD. Proton pump inhibitor is not a very intelligent strategy, although it may give him some instant relief, because what he's doing is he's suppressing acid production. But the problem is not too much acid. The problem is a structural problem. Also probably has to do with certain foods that he's eating. So number one, see if he could link the GERD to specific foods and then eliminate those foods. Processed foods, high carb foods, sugary foods, sometimes coffee and chocolate. There's certain foods that are linked to acid reflux. Acid reflux, by the way, is absolutely miserable. And I can see why he would be doing whatever he could do to stop it. Now, suppressing acid is going to stop acid reflux because you're not making acid, but it's also going to suppress your ability to absorb vitamins, to break down proteins, and to absorb minerals. So you need stomach acid. Proton pump inhibitors and low stomach acid will also increase the likelihood of SIBO. And SIBO will cause more heartburn and will cause more digestive distress and other health challenges as well. So when you start playing around this way with medication in order to reduce the symptoms that are associated with either a structural problem or poor lifestyle choices, it can tumble out of control. So what I would suggest he do is a food diary and eliminate problem foods. Start using apple cider vinegar with his meals rather than suppressing acid. So in an effort to kill off the bacteria, look for the FODMAPs foods, which is a strategy for reducing the nourishment that bacteria can get in the small intestine. In other words, go low FODMAPs, and then do all the digestive support supplements. I noticed the Daily Digest came back, which I'm very happy about, and that's a great digestive supplement. There's a healthy digestion pack that he can use, and he might want to consider that as well. Probiotics, all the digestive health supplements that we talk about all the time. That's probably the direction I would take. Now, the hiatal hernia, if he has a surgical, you can have a surgical procedure, and a hiatal hernia can be pretty miserable, that's for sure. Or there's also chiropractors who can do manipulation, and they claim that they can push the stomach back underneath the diaphragm. And I don't know if that works or not, but that's something else you might want to think about.
What about the possibility of having surgery? Should he try to avoid that at all costs?
Last resort, surgery should always be a last resort. Whenever you have surgical procedure done, you're going to run the risk of adhesions and fibroids, adhesions and fibrosis. Adhesions and fibrosis in the abdominal area can cause all kinds of problems. So surgery in the abdominal area should always be a last resort. If he does do surgery, and if anybody is considering surgery, get on the Healthy Bone and Joint Pack and the Ultimate Enzymes, taken on an empty stomach a couple weeks before your surgery, at least, and then continuing after your surgery, a month or so after your surgery to improve the healing and the prognosis.
Thanks so much. Back to you, AJ.
Okay.
Thank you, Phyllis. That's excellent question. And Ben, I know that we're a little bit over time, but we want to see if we can at least get in one more question from TC, who's got some issues with his mom. TC, can you unmute yourself? Or okay, TC,
Okay, yeah.
take it away.
Okay, Ben. Yeah, this is for my 94-year-old mother. She has osteoporosis and she had a blood clot. She's on Eliquis, metoprolol, amlodipine, and losartan.
Oh my
And
gosh.
I
I
talked
gotta write
to
all this down. I gotta write all this down. So she's got osteoporosis.
yeah,
She had a
and
blood clot.
yeah, and
Okay.
she's on Eliquis, metoprolol, amlodipine, and losartan. Now I talked to Doc Wallach about this, and he said to put her on the bone and joint pack and rebound, vitamin D3, and ultimate daily classic tablet.
Yeah, those are all great strategies. Don't forget the ultimate EFAs.
Yeah. Now, a couple months ago, she slipped off the couch and hurt her shoulder blade.
How old is she?
94.
Oh, wow.
94. Now, she's been having trouble walking. She uses a walker, but lately she's just been lying around and in bed and wasn't getting up. And I had to bring her meals, and she wasn't really toileting. So doctor said, not Doc Wallach, but her doctor said, take her to the ER and get her assessed. We're going to decide whether she needs a visiting nurse or rehab. So
yeah, well, they didn't tell you that they're stopping her heart.
Yeah, well, my brother's there, and he said they ran some tests and found out that her calcium is high, and she has some nodes in her neck.
No, look, they're, you know, when I hear stories like this, I think of Alexander the Great. You know, Alexander the Great, his famous quote when he, before he died, he said, "I am dying by the hands of too many doctors."
Okay.
That was what Alexander the Great said, and that was 500 or 400 BC, almost 3,000 or almost 2,500 years ago. So, your mom's being poisoned. That is a lot of toxicity that she's dealing with. Amlodipine, Eliquis, metoprolol, losartan. Those are not Skittles. Those are drugs that are shutting down her system. Now, I don't know whether she needs them or not. I can't say. Maybe she doesn't. Like I said earlier, like we said several times already, the doctors could care less about her ability to have a great life. He's just interested in her survival. You understand what I'm saying? That's not a bad thing. That's not a bad thing. And maybe I don't know. I don't know your mom. So maybe she needs these things and has no other choice. But of course she's going to feel lousy on these things. These are all serious drugs. So let me just say this real quick. So she's 94 years old. What's the purpose of putting her on all these drugs? They're not helping her health.
I know.
Right?
But that's
so, healthy start pack, like it's going out of style.
Well, my question is, the supplements have about 1,900 milligrams of calcium. They said her calcium is high, but that couldn't have caused the nodes. Come on, that's something.
Listen,
for a long time.
Your mom, that's like saying, I have a little mosquito. That's like having an elephant on your roof and worried about a mosquito flying around your head. You got an elephant on your roof.
Right.
It's not, the calcium is not causing the nose. This woman is being poisoned with 4 very, very powerful drugs. She's already in a deteriorated state. She's 94 years old, and she's got all kinds of biochemical things going wrong in her system. So
amlodipine is a calcium blocker, right?
Amlodipine, I'm pretty sure it's either a calcium channel blocker. Yeah, it's a calcium channel blocker.
Yeah.
So what does a calcium channel blocker do? It stops calcium from flowing into cells, specifically the heart cells, but all cells. Calcium is an on switch. It functions like an on switch. That's calcium's role in the body. One of its roles. It turns cells on. All cellular activity depends on calcium. If you block calcium from entering into the heart will not function effectively. Metoprolol is a beta blocker. That further suppresses the heart. So, of course, she's going to feel lousy.
Like, now they're saying what they want to do is lower her calcium.
They don't know what the heck they're doing.
Yeah,
they're playing. They're just, they're turning the dials around and see what happens. And your mom is the guinea pig. And that's a shame because she's 94 years old. Let her have a good life here.
Probably causing a kidney.
What would happen? What would theoretically happen? I'm not telling you to do this, but what would theoretically happen if she stopped taking the drugs? Theoretically, I'm only telling you theoretically. I'm not saying to do this, TC.
I think if she stops taking the drugs and she takes the supplements, she'll do better. I mean,
well, what could she have to lose? She doesn't feel great. She's not doing great now, is she? She feel like bounding out of bed now, and she have a lot of energy. She's all happy and excited to be alive. No. So what's the point? And that's kind of how we have to look at things. The doctors don't look at this because they just want her to survive. They're not looking at her quality of life. So I would get her on the Healthy Start Pack. Make sure she's doing all of her basic nutrients, making sure she's getting enough protein, a little bit of exercise if she feels like exercising, and tell the doctors, or have her tell the doctors that she wants to wean herself off her meds. What could happen?
Okay.
What's the worst thing that could happen? She already feels lousy, and the medicine could likely kill her. We don't know. What would happen if she got off her meds with her doctor?
Okay. Well, what about the Eliquis? I mean, she can't stop.
Eliquis is a horribly nasty drug, but I don't know her condition. Eliquis is a blood thinner. The blood will clot when it's not moving effectively through the vasculature, through the circulatory system.
And she doesn't move around much. She doesn't.
Well, hang on. Let me just say this real quick. Eliquis, the blood will clot. Eliquis is a blood thinner. The blood will clot when it's not moving around fast enough through the circulatory system, right? It's kind of sluggish. That's when it tends to clot, when it's not moving. But they're giving her drugs that are slowing down the movement of the blood. Right?
Okay.
So maybe if she wasn't on the metoprolol and the amlodipine, which have a slowing down effect on the heart and the circulatory system, maybe she doesn't need the Eliquis. I don't know the answer to these questions. I'm not telling you like I know. But it seems to me like she couldn't be worse off if she weaned herself off her meds.
And what is losartan? You said that's a horrible.
Well, losartan is the real big problem is the Eliquis and the amlodipine and the metoprolol. Losartan is an antihypertensive. It's not quite as strong as the other three. It works a little bit more with the kidneys, but it's still a downer. When I was a kid, there used to be drugs, they call them uppers and downers. Did you ever hear those terms?
Yeah,
uppers and downers, right? I don't know how old you are, TC, I can't see it, but back in the day, they would say uppers and downers. All of those drugs are downers. They're suppressing things. Losartan is probably not the worst of the bunch, but it's still a downer.
Yeah. Okay. TC, we hope that helps, and we're with your mom.
And by the way, is she drinking? How much water is she drinking, TC? Is she guzzling water?
They say she's dehydrated.
Yeah, well, that could be a huge part of the problem right there.
Yeah.
That'll cause problems with the circulatory system too.
Okay. Okay. Well, thank you very much.
Yes, and everybody should recognize that drinking water, plain old water, and beyond tangerine water is one of the most powerful, non-toxic, multifunctional, cheap, and easy ways to stay healthy, especially for the blood, especially for people who have a tendency to clot, for the blood to clot, for our friend who's dealing with GERD, also, and for people who have low energy, people who have high blood sugar. Just plain old water and beyond tangerine is a powerful way to nutriate the body. Just clean water and a little BTT. Okay.
Okay.
Thank you, Ben. Do we have time for one more, Ben?
Quickie.
Okay.
I had a hard stop 13 minutes ago.
I'm so sorry, Ben.
That's
but
all right.
It's your fault for being so
right.
informative and popular. Verna, we're gonna ask you to unmute. What do you have for us, Verna?
Good afternoon. Thank you so much for taking my question. Thank you, Ben. You're always so phenomenal. You're just a storehouse of information. So I first want to say that I use the Niacin Plus along with the Ultimate Daily Classic for my blood pressure. And it's been very well, keeping the blood pressure normal, to a normal.
I'm sorry, you're cutting out a little bit.
Verna,
turn off your camera so we can hear you. Go ahead.
Okay, what I said, I use the Niacin. Can you hear me now?
Yes.
I use the Niacin, and I also use the Ultimate Daily Classic to maintain my blood pressure.
Okay, good.
Okay, so I just wanted to mention that someone had told me to use the Niacin along with the Ultimate Daily Classic, okay. And so it's working for me. Okay, so my other issue is I was going to go to the doctor, but I wanted to get on here first and ask about something that's on my arm. It was like a pimple or a blackhead, and it's kind of sore all around. It's almost like a lump there. It's on my the upper part of my arm, and I'm wondering what I could.
Can you show it on camera?
Oh, I'm not sure. How would I put it on the camera?
Go ahead.
Oh,
Start
start
your
my
video.
video. Okay. Okay.
Okay.
Let me see, because I'm not really understanding what you're saying here.
Hang on. Hang on. All right. Let's see your arm. We can't see your arm. Let's see your arm. Show us that arm. Okay. We can't really see it. So why don't you just, okay. We see a
Hard to
little
say.
something.
I don't really see it, Verna.
She
I'll tell
may
you what,
need to turn off her virtual
No,
background for you to
Verna,
see.
Verna,
Yes.
why don't you just text me a picture and I'll call you. Because I can't really tell without looking at it.
Okay. Text you a picture.
Get my
Where
phone
am I
number.
gonna-
Get my phone number. And by the way, you guys, anybody out there listening, my phone number is 303-817-7665. And you can always give my phone number to people if you think I can help them, or you can call me, or if you want to do three-way calls, I'm happy to help. Give me a couple days. Sometimes it takes me a couple days to get back to you, but I'm happy to help. And then Verna, if you'll shoot me a text with a picture of that, I'll give you a
Okay.
call back. Okay.
Okay. Very good. Thank you. I appreciate it.
All right, you guys. Thank you so
Okay,
much. Thank you, Becca, AJ. You did a heck of a job. Phyllis, as always, Marilyn, and Doc. Thank you, everybody. Happy Doctor's Day to everybody, including Doc Wallach. And we'll see you next week.
Thank you, Ben. Thank you very much. We're just gonna bring up our other folks, and I know that this is.
Thank you, Pharmacist Ben, for all that you do and for, going past that hard stop, because we have a lot of people that are hurting and wanting answers, and we appreciate you and Dr. Wallach for all that you bring to the table for us to be more knowledgeable and our own health authorities.
Bye.
Okay, well, that is thank you for joining us, folks. Happy holidays to everybody. I just want to say a special shout out of thank you to our host and team leader, Becca Dukes, for making this possible for us. And the lovely Marilyn Pazier, who gets all the information in the chat with us. And my boss, Ruth Ellen Sanchez, who gets on here and makes sure that people can actually see the stream. And we have our good friend, Phyllis Anderson, who preceded all of the stuff that we do here. And Becca is going to take us out.
All right. Thank you, everybody, for joining us here on Pharmacist Friday with Pharmacist Friday on Daily with Doc. I'm out of practice. I just want to thank everybody for taking the time and investing it in yourself and allowing us to help you find a better health journey. Thank you, everyone. Have a blessed day and happy Easter.
much.